this is Dr. David Tam, President and CEO of Beebe Healthcare, and welcome to another edition of Tuesdays with Tam. Where we sit down with our new providers and sometimes some of the providers who've been here for many, many years and share with you what they're doing and the new services that we're bringing here into Sussex County. Now, today, I'm really excited to be speaking with Dr. Tarek Waked. Dr. Waked is a bariatric and general surgeon who leads Beebe Healthcare's Center for Weight Loss Surgery. He completed his residency in general surgery at INOVA Fairfax Hospital in Virginia, and during his years of training, Dr. Waked has received multiple awards for his skills and knowledge in surgery. Following his training in general surgery, Dr. Waked joined the esteemed Mayo Clinic in Minnesota, by the way, the other health system in America started by two doctor brothers. We know where the other one is. And at Mayo Clinic, he actually completed a fellowship in minimally invasive and bariatric surgery. So it's really exciting for me to be able to speak to Dr. Waked and also introduce him to you. He's certainly been here actually for several months and has been working very hard and has seen a lot of patients. So I'm really excited for the opportunity to share with everybody out there who Dr. Waked is, talk a little bit about his clinical practice and his philosophy about healthcare, and also a little bit about himself. So, Dr. Waked, welcome to Team Beebe. I really have been excited to both have you on the team and then to looking forward to this conversation where we can share with everybody else who you are and what you've been doing. So, how are you? How have you been doing?
I'm doing great. Thanks for asking. I'm very excited to join Beebe. And thank you so much for having me.
Well, the pleasure is all ours. And you've been here for now a couple months, but a little bit about your background. You're really a distinguished surgeon, and you have a lot of expertise in weight loss surgery that is not just local, but regionally recognized at pretty much the best there is. What interested you in this field of bariatric surgery in the first place?
Well, first of all, thank you for those kind words. I think 30 to 40% of the American population suffers from weight issues, mainly obesity. The main struggle is they are always trying to look for losing weight with diet and exercise. And I think the most common misconception is that you can treat those weight struggles with eating the right food and exercising. So the reality is those weight struggles and the reason for the weight struggles is much more complex than just eating the right food and exercising. I always tell my patients there's a lot of things involved, including genetics, biological changes in the brain and the body, hormonal changes, slow metabolism. So all these things actually play against the patient in succeeding with their weight loss. And so knowing that there's something I can do to help those patients, that's helping 1/3 of the American population to get healthier. When someone comes in and tells you, I've been suffering from diabetes, from high blood pressure, from sleep apnea, back pain, heart disease, and you tell them, well, I can offer you a solution for that. I can offer you a tool where you can actually get rid of all diseases, lose weight, and improve your overall health. So that is a very rewarding thing for me, seeing those patients get healthier by giving them that tool. And if you look around in medicine, very few interventions will improve those weight-related diseases as bariatric surgery does.
Well, it's really amazing that people still out there, the culture still sees obesity as sort of some kind of failure.
Yeah.
And it's really not, isn't it? And really, there are so many ways to treat it and to address really a medical condition.
Yeah, and that's really sad. There's a lot of weight bias against people struggling from weight. There's a lot of common things that my patients hear, just, you gotta get rid of the junk food, you need to exercise and you'll be fine. And the reality is that's not it. No. I'll say 40-50% of the weight struggles are related to food, to exercise. But the other 40 to 50% is related to actually what you are made of. Your genetics, your metabolism, your hormones, your biological changes, all that will work against the patient and make them gain the weight back. No matter how hard they work, how hard they go to the gym, how good they eat, there's something else that will bring them back up to the previous weight that they had.
It really is sort of this multifactorial process, and
Yeah.
I know that you are really good and like to tailor your care towards these patients and their needs. Why is that so important for you?
I think if you ask patients around, they will tell you, I'm always treated like a number. And we know even in healthcare, there's bias against people who struggle from weight. I want patients to come to our office, to come our practice, and be treated as if we really care. We want them to know we understand your struggles. We want them to know, no, it's not only about what you eat and the fact that you're not exercising 5 hours a day in the gym. We want them to know, we understand the disease. We're here to help you, and there's no bias. There's no judgment. We will treat you without judgment, and you'll find that I think patients appreciate it. Another thing is each person has a different etiology or cause for their weight struggles. Some people might be genetic, some people might be medications, some people might be their diabetes, some people might be their slow metabolism, and some might be their hormonal changes. And so we have to identify all these issues patient by patient and treat them accordingly. You can't just use the same approach for everyone. And so we focus on a personalized approach for each patient.
Now, you've been a recognized and award-winning surgeon already for so many years. What brought you to the point where you came to join Team Beebe?
I think the key is the vision that Beebe and I have. We share the same vision in providing personalized care, but at the same time expand that care to Delmarva. I believe Beebe will help me reach that stage. We want to offer our services to as many people as possible because we know that we can help. We know that there's someone out there suffering from diabetes who can get our help and get rid of diabetes. We know that someone out there suffers from high blood pressure, from back pain, and we can give them the tool to get rid of that. And we know that this is not the easy way out. We want to tell patients this is the healthy way out to these weight-related struggles. I think it's very common for people to say, or family members or people struggling from weight to say, you're taking the easy way out. That's not the truth. This is a treatment for a disease that's going to make you healthier. It's a tool to get there where you want to be. And it just makes my day when I see a patient say, now I can go on this roller coaster with my family, with my kids, without having to struggle. Now I can go walk through Disney Park or Disney World without having shortness of breath. So these rewarding experiences really makes you want to join an institution where you can expand that care to as many people as possible.
What's really rewarding to me, I think, I don't practice it, but when someone says, because of the bariatric surgery that was successfully done, I've been able to get off of insulin.
Yeah.
That's amazing if you think
Absolutely.
about where we've gone as healthcare in the last 10, 15 years.
Correct. And, some people go home from the hospital without insulin.
Yeah.
And, just knowing that you just left the hospital after a 45 minute operation and you're insulin free, that's a huge, success story. Also, people need to know that nowadays surgery is really safe. Before, 25, 30 years ago, people were having issues with bariatric surgery. But nowadays, Everything is done with the tiny incisions, laparoscopically, fast recovery, and the complication rate is less than 1%. The risk of living with obesity far outweighs the risk of surgery nowadays. Knowing that you can get your surgery, go home on the same day of the surgery or the next day, and have a 99% success rate is very reassuring.
Now, I got to ask, I know that you and your family have come more towards the eastern part of Sussex County, moving in that direction.
Yep.
Is that an exciting thing? Especially for me, this is my first summer here in Lewis, because last summer everything was pretty much closed up.
Yeah.
How's the transition for you and your family?
That's very exciting. Especially my family is very excited to be here. There's a lot of things to do here especially for my son, and we are really excited to be part of the Lewis and Rehoboth Beach family. Yeah.
Well, that's great. And we're really excited to have you join us. Beebe Healthcare, as you know, is really focused on trying to be transformational, innovative. I think your office is something we're building out in Georgetown. Is that right? Maybe you can talk a little bit about that.
So right now we have an office in Georgetown, and we chose that location to be central. We have patients driving from Wilmington, from Dover, some people coming from Salisbury and Maryland and Easton. So we wanted to be central to the Delmarva area. And we have a really nice office. We have a great team that joined us. We focus a lot on support. We want patients to feel like, okay, you're getting the surgery here, but more importantly, we are there for you to support you after the surgery. And I think a lot of the programs in Delmarva don't have the amount of support that we give to our patients. We also, Beebe is building a bigger office for us to expand, which is going to include a large conference room where we'll be doing fun support groups in person. We'll be doing some cooking classes. So there's going to be a lot of activities for the program and for the patients. And we are hoping later this year we're going to have a 5K for our patients, which is usually very successful. I really enjoy running or walking the 5K for my patients, and we're hoping to organize that for this year.
Great. Well, I have to tell you, I'll be there for the 5. I can do a 5K. Awesome. I can maybe even do a 10K. But thank you so much for joining us. And thank you so much for all of you for joining us today on another episode of Tuesdays with Tam, where we are bringing in the doctors that we have brought here. We've recruited actually over 60 physicians and providers in the last year to come serve the people of Sussex County. It's all about, for us at Beebe Healthcare, Sussex County. And one of the reasons why Dr. Waked is going to have his office in Georgetown is because we really are working to move into the community, to expand out beyond the eastern part of the county, because our mission is to serve everybody who lives, works, and visits here in Sussex County, and that certainly includes Georgetown, Millsboro, all those areas down in the South Coastal area. And I'm really excited to have Dr. Waked here to serve as we continue to not just build a program, but grow the program with more doctors coming in to serve people here in Sussex County. So we're going to continue Tuesdays with Tam. Stay tuned as we have more physicians that we want to introduce to you. As you can see, we are very exciting, we are very dynamic, we're very innovative, bringing in all kinds of experts who are going to bring the best quality of healthcare to Sussex County to really, really get to our vision of being a great community health system. So on behalf of Beebe Healthcare, by the way, if you heard the clock, I'm going to tell you, we're of course recording this from the historic home of actually Dr. Richard Beebe himself here at the Medical Foundation office. We've been here for 105 years to serve Sussex County, and we intend to be here for another century with new doctors like Dr. Waked and other people to serve the people of Sussex County. So on behalf of all of us here at Beebe Healthcare, thanks for joining us, and we'll see you next time on Tuesdays with Tam.